Hi, I'm Medley Shamp. I'm the Chief Ambulatory Officer at Astera Health.
And I'm Dr. Steve Davis, a family practice doctor for a couple of years here at Astera Health.
And we're here today to talk to you a little bit about what is a Medicare wellness visit.
And all of you out there, especially my patients, I guarantee you we've had this discussion as to why do you make me come in here twice? And basically, I don't want you to come in here twice. I would rather see you once and be done. And I'm sure you would too. But we're going to try and discuss a little bit today about where this came from, why it's happening, and hopefully that you'll get a sense that it's a benefit for you. We're going to try and figure that out for you and see what else. And if anyone has questions, you can always talk to Medley. She knows everything. So
I don't know if I know everything, but I've learned a few things.
Yeah, she's learned a lot.
What I've learned about Medicare wellness, especially lots of patients have reached out with concerns, providers reach out with concerns, and I'm not of that age group yet to experience Medicare. So lots of time has been spent to try to figure this out. And
by the way, me either.
You're not there either yet?
Yeah.
We had a little bit of time. What the program offers, so Medicare Part B will offer through your plan benefit once a year for you to see the medical provider of your choice. So you can see any family practice provider, MD or APP, advanced practice provider, at Astera Health, any of our locations, for what's called a Medicare Annual Wellness Visit. And that's a very specific type of visit with your provider that is hands-off. And I think that's where the first part of some frustration comes from our patients. But what they're looking for, what Medicare wants us to make sure that we set a time every year to review, is do you have an advance directive on file? What's your height, weight, and latest blood pressure? What medications are you taking? Have you had any changes in your cognition or your memory, or any problems with doing your tasks at home? Because this could be an opportunity to start looking for resources for you there. Medications, allergies, vaccines, it's really meant as a preventative visit. Did I miss anything that we go over at that visit?
Oh, tobacco use, alcohol use, any sexual health questions. There's a whole list of things that we generally talk about at this visit.
The important thing is our nurses have to ask you a lot of questions, and our doctors have to ask some specific questions of you while you're being seen. And in that visit, it's important for us to make sure that we answer all of those questions, because Medicare will then feel that that visit's been completed and we can process that bill out the door to no cost to the patient.
It's really led to a lot of unhappy folks because they just don't really like the idea of having to make 2 trips here, take time off of work, or time off out of the field, time out of the garden, whatever it is that they're doing, to come in here and have the same thing and sit around and wait, and it's not convenient. What we're trying to do today is explain that that's what's going on. It's not that we're trying to fleece you guys for extra stuff. It's like we would just as soon, and I would specifically just as soon, take care of this whole thing in one visit.
Yeah.
But my hands are tied, and that's because of all of these regulations.
Yeah. So we are able, if we find something wrong out of that visit, or I have additional health problems, I could come and see you for a second visit. And if I say I have diabetes, I'm probably coming to see you a couple times a year anyways to get that checked out. But we could then have that visit separate if the patient wants to come in, or you determine that it's needed. And that's where you could then take a listen to my lungs and do an evaluation, or take a look at my swollen ankle.
So when you come and get your comprehensive medical exam, AKA physical, that's covered by your supplementary insurance if you
according
have
to their
it.
normal plan.
Okay. So the issue comes down to payment. So
we're trying to not make the patient pay for a visit that is already a benefit to them. And there is valuable information in it. It's just the process in which it has to happen is where the frustration comes from both sides.
So, all right. Yeah, and actually the Medicare Wellness is very good for making sure that you're up to date on immunizations and any other kind of tests that you might need, like colonoscopies
Yeah.
and mammograms and whatever else. So it's a good time to come in, find out what you need to get done, like, say a bone density test. Those are all things that we can get set up.
And we can do all those right at Astera.
Yeah, those are things that we can get done within probably a week or so. Colonoscopies I can usually get taken care of within 2 weeks.
So if the patients that want to get in to see you or any of your colleagues for either one of these visits, the Medicare Annual Wellness Visit or the Comprehensive Medical Exam, they can call Astera at the 218-631-3510, or they can use MyChart if they're a MyChart user.
Yeah.
We have both direct access and open access scheduling. So patients
Sure.
can use lots of different ways on their phones to get those appointments made as well.
The main thing for us and for you guys is that we're not trying to rip you off. We're not trying to make extra money off of this thing.
Yeah.
This is kind of a deal. It's how we have to do it in order for, basically it's for your benefit, because we're trying to save you money so that everything that happens is covered by Medicare and you don't have to get a bill.
Yes.
That's really what's going down here. So if you have any questions about it, let us know. But all of the services that we have here, we can get them squared away with what's happening. So you need anything, pretty much. I mean, there's a very few things we don't have available, and if we don't, we know good people that will take care of it.
Right.
So
we sure do.
So it's to your benefit to get in for your MAW and just take advantage of it.